Here are some issues that may arise from wearing high heels for a prolonged period of time. Number one, toe deformities. Now, wearing high heels for a prolonged period of time could lead to what we call hammer toe, and this is because of the narrow toe box in high heel shoes. And as a result of that, it will push those toe a bit backwards and make them a bit retracted, and the muscles that attach to those toes will start to assume that position. Now, if this carries on for a long period of time, even without the high heels, the muscles might just assume that position and lead to toe deformities. Another thing that can happen is bunions. Now, bunions are more like deviation, medial deviation of this bone here, and the lateral deviation of that one. And that could lead to the formation of a bony bump around this area that can be very painful as well. Sometimes it can be without pain, but sometimes it could come with a lot of pain and discomfort and affect the patient's mobility as well. This can be attributed to the narrow toe box in high heel shoes or wearing quite tight shoes. There are other factors that can cause this. It could be attributed to genetics and also injury as well. Another thing that can arise from wearing high heel shoes for a very long time or very long period of time could be arthritis of the knee. And this is because high heel shoes will upset the balance of the patient and as well as increase pressure in the inside of the knee that can contribute to knee osteoarthritis. One other thing that can happen would be tightness of the calf muscles. Now you've got calf muscles or your calf at the back of your leg, and with the foot assuming that position, it means that this muscle will kind of like be in a contracted position really, because the muscles come from here and they have like a band or a rope that attaches to this area, and this is the Achilles tendon. Now with the foot and the heel in that position will mean tightness there, so more like tightness in the calf muscles, which means that even without that heel and this muscle being tight, it will be difficult to sort of like move your foot in that direction. Now, biomechanically, we expect it to have about 90 degrees plus a 10, okay, or like a 10 degrees in that direction to facilitate a smooth movement. But with tightness of the calf, you barely get to 90 degrees. This means that your biomechanics will change. The way you walk is also going to change without heels, and that can cause problems in the ankle, problems in the knee, problems in the hip, and also pain in the lower back. One other thing that can happen with wearing high heels for a prolonged period of time is what we call metatarsalgia. Now, what that means essentially is pain around the ball of the foot. Now, with the foot in this position as well, it will lead to increased forefoot loading. So, increase of loading and pressure in this area of the foot, which can be problematic, especially in patients that are immunocompressed or immunosuppressed. This increased forefoot loading will mean that there will be buildup of hard skin, callus, corns that could potentially ulcerate and cause problems for the patient. Remember that the body is a kinetic chain, and what happens to the foot can affect the knee, it can affect the hip, it can also affect the lower back. Now, there's one more bonus point. Now, another thing that can happen when you wear high heels for any period of time, it doesn't have to be prolonged. It could be the risk of falling. So, wearing high heels for a long period of time will mean that your center of mass will kind of like shift from your base of support, and as a result of this, you will not be stable enough, and this increases the risk of falling, sprains in the ankle, as well as fracture. If you have any foot and ankle deformity, see a foot and ankle specialist or see a podiatrist as well. Thank you.